Good morning, everyone. I'm Sun Hui from the Department of Rheumatology, the first hospital of China Medical University. Today we are talking about systemic lupus erythematosus. Briefly, we can call it SLE or lupus. First, we will look at definition. SLE is an autoimmune disease in which the organs and the cells will undergo the damage immediately mediated by the tissue binding autoantibodies and the immune complexes. The autoantibodies are present for a few years before the first clinical symptoms appears, and the clinical manifestations for the lupus are heterogeneous. And almost 90% of patients at the diagnosis are women of childbearing years. And the prevalence of lupus in our country in China is 30 to 70 per 100,000 people. And in the whole world is 10 to 40 per 100,000 people. So the prevalence in our country is higher than that in the whole world. And the highest prevalence is in black women, and the lower is in white men. The pathogenesis for lupus, briefly, is the interaction between the susceptibility genes and the environmental factors, which result in the abnormal immune responses. The abnormal immune responses include the activation of innate immunity, and the cells involved in the innate immunity include the dendritic cells, the NK cells, and the monocytes, etc., and also including the activation of the adaptive immunity. The cells involved in the adaptive immunity include T lymphocytes and B lymphocytes. And also the abnormal immune responses include the ineffective regulatory T cells. And the regulatory T cells, we can call it Treg, including the CD4 positive Tregs and CD8 positive Tregs. And also reduced clearance of the immune complexes can be sold in the patient of lupus, and also the reduced clearance of apoptotic cells. So the pathogenesis for lupus is the abnormal immune responses result the excessive abnormal production of the autoantibodies and the formation of immune complexes. The autoantibodies may against the nuclear, the cytoplasmic, and membrane components of the multiple cells in the multiple organs. The etiology of lupus, to be honest, at this moment, the etiology of lupus is not very clear. But obviously, there are some factors can trigger the lupus occur. Let's include, first one is the genetic factors. We know that lupus is a multi-genetic disease, and some of the susceptibility genes increase the relative risk for the SLE patients. And the morbidity in the monozygotic twins will increase a lot compared with the digonic twins, will increase 3 to 10-fold. And also, the first degree relatives for the lupus patients, the relative risk will increase a lot too. It may increase 8-fold or even greater. The next etiology for the lupus is the environmental factors. First one is ultraviolet light. About 70% of lupus can be flared by exposure to ultraviolet light. And some medications, such as penicillin, such as anti-TNF drugs, such as interferon alpha, can trigger the lupus. And some food, such as saturated fats, and some infectious agent, such as EB virus, can also be the agent that trigger the lupus in some susceptibility individuals. The next etiology for lupus is the sex hormonal factors. We know that the lupus often occur in the women which are childbearing age. The female to male ratio is 9 to 1. And so it means that the sex or hormonal factors may be involved in the lupus, such as the estrogen, such as the progestin, may involve in the etiology of lupus. So in briefly, the etiology of lupus is the interplay between the genetic susceptibility, the environmental, the gender, and the abnormal immune responses may result in the autoimmunity. The pathology for the lupus, in briefly, is the inflammation and the vasculitis. The autoantibodies and the circular immune complexes can attack the vessel of the organs, can induce the inflammation and necrosis of the vessel, and result in the organ dysfunction. That's all for today's lesson. Thank you very much.